How accurate is neurological testing for multiple sclerosis? When it comes to understanding how accurate neurological testing is for multiple sclerosis, or MIS, there are several important factors to consider. Neurological testing typically involves clinical assessments, imaging techniques, and sometimes laboratory tests. The accuracy of these tests can vary based on the methods used and the stage of the disease. First, let's talk about clinical assessments. These are essential for diagnosing MIS. They include a detailed medical history and a physical examination to identify symptoms like vision problems, muscle weakness, and coordination issues. While these assessments are crucial, they can be somewhat subjective. The accuracy can depend on the experience and expertise of the healthcare provider conducting the evaluation. Next, we have imaging techniques. The most common one used for diagnosing MIS is magnetic resonance imaging, or MRI. MRI scans are effective at detecting lesions in the brain and spinal cord that are characteristic of MIS. The accuracy of MRI in identifying these lesions is quite high, especially when advanced techniques like fluid-attenuated inversion recovery sequences are used. However, interpreting MRI results can be complex and may requiring a skilled radiologist, particularly in the early stages of the disease. Recent advancements in technology, such as deep learning and radiomics, have improved the precision of lesion detection in MRI scans. These innovations enhance the ability to accurately identify and quantify lesions, which is vital for both diagnosing and monitoring the progression of MIS. Laboratory tests also play a role in diagnosing MIS. Tests for oligoclonal bands in cerebrospinal fluid can support the diagnosis. While these tests are not definitive on their own, they can confirm a diagnosis when used alongside clinical assessments and imaging findings. Emerging research is looking into biomarkers, like neurofilament light chain levels in blood and cerebrospinal fluid. These biomarkers show promise for monitoring disease activity and progression, but they are not yet widely used in everyday clinical practice. It is important to note that while neurological testing for MIS is generally accurate, there are limitations. In the early stages of the disease, clear signs may not always be present, and some symptoms can mimic other conditions. Therefore, a comprehensive diagnostic approach that combines clinical assessments, imaging, and laboratory tests is crucial for an accurate diagnosis. In summary, the accuracy of neurological testing for multiple sclerosis is high when using a combination of clinical evaluation, advanced imaging, and supportive laboratory tests. Ongoing research continues to improve diagnostic precision and monitoring capabilities, which is encouraging for those affected by this complex condition. Always consult with healthcare professionals for personalized medical advice.